good morning and a warm greeting from Department of Orthodontics and Dentofacial Orthopedics, Hi-Tech Dental College and Hospital. I am Dr. Pavitra. I am working here as in the capacity of professor. I am here in Hi-Tech Dental College for almost 11 years now. Hi-Tech College has been very kind and generous in having me working here, getting to see so many patients of various various diseases and related to our fraternity. Now, what is orthodontics? Orthodontics is basically, like in common, if I have to tell you, it is about braces treatment. Now, you would have heard clip treatment. Now, what do they do in orthodontics? Now, orthodontics by itself is not just about teeth, I would like to say. Now, it is also related to treating the teeth, correcting the teeth, and also the correcting the jaws. Now, if there is any kind of problem with the jaws, now we call this as a particular jaw and this as a particular jaw, and we have the jaw, the teeth within the jaws. So, it is not just about the teeth, it is also correcting the jaws together. So, that is why this department name is Orthodontics and Dentofacial Orthopedics. Now, what kind of patients come here? Now, we have a range of patients who can be treated from the age as early as 6 years or 6.5 years and up to the age of 50 years. There is no age limit for this kind of a treatment. Basically, we deal with something called as irregularity in the teeth or correcting the irregular teeth and irregular jaw. Now, what happens if there is no correction which has been done at a particular age? Now, we have the time period which is, this department also deals with different time periods. We have treatment which is done for smaller children, we have treatment which is done for a little bit of, children who are little grown like teenage or adolescent, and then we treat adult patients. Now, the treatment varies for every age. So, whenever we see this kind of irregularity related to jaw or related to our teeth, it has to be according to the age. Now, if we get a patient which is as early, if we are able to diagnose the patient as early in the age period, then we will be able to give a better treatment, use their growth and give different kind of treatment modalities, and different type of treatment options are wider for the younger age group. But as and when the age grows, the bone and teeth are also settled in a particular fashion that there are limitations in our treatment also. So, not only that, the dentofacial orthopedics has also included a lot of wide variety of deformities related to the bone and related to the jaws, which is in the head and neck. So, we are also somewhere related to, we are also called as head and neck orthopedic people. So, that is, we deal with the craniofacial syndromes, cleft lip and palate, any kind of deformity, any kind of syndrome which is associated with your upper jaw or your lower jaw. So, these are the various kind of things which we deal with, and in Odisha, like we can, like what I am seeing for the last 10 to 11 years, we have seen a lot of people having jaw problem, especially with related to the upper jaw, as well as we see a lot of plenty of cleft lip and palate, young kids with cleft lip and palate patients coming from little periphery of Odisha. So, this has also been dealt with very carefully in our department, and we also have an interdisciplinary kind of an approach where we do treat teeth alignment, and also we adjust the jaw and give for the surgeons, so that thereon the surgeons will we have formed a base for the surgeons to correct their jaws, whether it is the jaw problem include your upper jaw being very forward or your lower jaw being very backward. So, these are the kind of things which we usually deal with, and as such, like we have already discussed, that this treatment duration is about 1.5 to 2 years. There is no hard and fast rule for this treatment, and there is no shortcuts like it can be done in 3 months, 4 months, no. So, there is a kind of steps which we have in the clip treatment, where minimum of 1 year plus or minus 6 months or 12 months to 18 months is the time duration. The time duration is very critical in our field, and as I said, there is no hard and fast rule for this kind of treatment. So, the main thing is people, most of the individuals are having to deal with day to day irregularity in their teeth. the most important thing is visit your orthodontist nearby, visit the orthodontist which which is available in the college facilities. So come, have a diagnosis, have a checkup, and get to understand what kind of treatments are available and what can be done best to correct your teeth and correct your smile, which will definitely increase your confidence. Thank you.